Welcome to this presentation on hand hygiene, the first line of defense to prevent infection. My name is Christina Taylor. I am an RN and in my capstone of my bachelor's degree at Herzing University. During this time of the COVID-19 virus pandemic worldwide, it is very important that we are especially focused on hand hygiene and infection control. There are several points that I will make during this presentation on the education of CNAs in a skilled nursing facility. Situational leadership is very important in this realm because this is a situation. This type of leadership is the best for when situations arise. Keeping long-term employees, making sure that they are part of the change is going to be very important to embrace because this isn't a new concept. It really is protecting ourselves and residents against this unseen threat of viral disease. Nurses are constantly working in a high stress situation with possible lack of resources and time, and especially now with people being quarantined, there may be situations where the staff is lower or even the census in the building is lower. So it's really important. Like I said, hand washing is not something new. So it is something that we have to change in our minds and in our day-to-day time management and skills. I identified the problem with the 40% of nurses not using proper hand washing techniques. Even in my skilled setting, I have seen nurses not wash their hands, not hand sanitize between glove changes, and it's a big problem. It seems like it is the last thing to be done when it comes to patient care, when it should be the first. Not having inadequate hand washing, hand sanitizing can cause longer hospital stays. It can increase antibiotic resistance, increase healthcare costs, and more people dying from nosocomial infections. The problem of not utilizing hand hygiene has increased the spread of COVID on a global scale, not just hand washing and hand sanitizing, but it is an important part of preventing the spread of the disease. And this education and the administration of immunizations, hygiene procedures, and food prep techniques all have come in question during this crisis. This is not the only pandemic. The pandemic of 2009 also had these issues, not on such a worldwide scale though. A SWOT analysis looks at the strengths and weaknesses, opportunities, and threats. Some strengths that I found in the skilled nursing facility of Cedars in St. Louis Park, they do have a 4-star quality rating, which means that their surveys have been good. The assessments, keeping down infection, keeping down catheters, giving immunizations, all of those play a part in the rating. It just means that we're a viable facility. There is a large corporate support with Cedars and with education, with sharing among the 11 buildings that are in Minnesota. That is definitely a strength. One of our weaknesses is that there is a high turnover rate of nursing assistants and nurses. And onboarding a nurse costs a lot of money and time. And a retraining is an issue. Non-compliance, of course, with our documentation and with hand hygiene, it's a big problem, and that's where education comes in. So our opportunities is that we do utilize the Relias education model, where it's over a broad scale. It is where we can open up modules that all staff are assigned, and we can monitor the compliance to realize and know who is doing what and who hasn't done their education. This also holds those nurses and nursing assistants and everyone in the building, all employees, to a standard of you've received the education. If you don't understand the education, ask questions. We also utilize POC, or point of care. It has really wonderful parts and things that make life a lot easier when it comes to communication, because we all use the computer, use the modules, and it's an excellent way to communicate to a large group of staff. Threats, of course, public health pandemics, the flu, the COVID-19, and a high level of competition among assistant livings. A lot of staff can just go to another facility. Residents can just go to another facility. So we really have to hold ourselves to an entire different level. During my literature review, there's lots of literature on lowering the morbidity and mortality rates worldwide by increasing hand hygiene. To provide funding for the education, it's really important that we get the funding to educate our staff on the hand hygiene. And hand hygiene includes sanitization too, and using of hand sanitizer. The literature also identified barriers to education programs or in-service models, such as when it's online and you're not really getting that skills issue or the skills testing. Being able to create a worldwide atmosphere of cleanliness, culturally appropriate, enhances compliance. All of the literature really struck me as, we are at a point where we are multicultural United States. We are the melting pot, and that transfers into our skilled nursing facilities, especially in St. Louis Park, which makes for a wonderfully diverse team. But that means that we have to be sensitive to those cultures and languages and finding those barriers. The leadership theory, there are quite a few. I looked into the situational leadership, especially. It is branched off of other theories, but this one accommodates the current issues. It's an individualized staffing, staff member, and the environment, and it's to achieve the highest level of compliance and staffing satisfaction. It's very important that we look at the individual and look at the situation, every situation that occurs, and look at it for what it is. Are there enough hand sanitizers in the hallway at appropriate distance? Is there paper towels? Is there soap? Does the faucet work? Does the drain work? Is it in a place where the staff can easily utilize it? The change theory, this is historically proven to be effective in the management of change of policies and procedures. The status quo is not considered to be good management strategy when it comes to nursing care. Just staying the same is no longer considered to be good management. We should always be changing, always be looking, always be finding, and this is the most familiar and therefore possibly the most effective for the change, is the unfreezing movement, refreezing, that Lewin's theory. It has been the most effective when using nursing process for change theory. There are other models combined into this process, and the driving forces are for the change and restraining forces are against the change. And you're going to find those changes. The driving forces are, we must do something to prevent the spread of COVID. Restraining forces are those terms of, this is the way we've always done it. This is the way we're going to keep doing it. And that's where we have to unfreeze that mentality. So during the evaluation, it takes the unfreeze, change, refreezing process, takes the status quo or the equilibrium or how we're doing things to a new equilibrium, even with those driving and restraining forces, because it's so important that we focus. And the Havelock situational theory really focuses on building those relationships with your staff, really looking at what the problem is. Is it environmental? Is it cultural? Is it something else? And then finding resources, selecting a path, establishing that acceptance, and then maintaining that change. It takes on parts of the nursing process, which really speaks to nurses. I really believe that using the nursing process in all different types of change and education is really going to put it in perspective for nurses. Nurses are we're taught ADPI right from the beginning: assess it, diagnosis, plan it, implement it, and evaluate it, and then around and around and around. In the end, we really want to feel empowered. We want our staff to feel like they are making the change, is that they're not being told, they're being shown. We need to support the staff and the program for the staff to gain the knowledge and understanding. They are at the front lines of battling this disease. It is effective in prevention. We really need to make it culturally appropriate. It's just so imperative that we look at this from the healthcare workers' perspective and not management looking down, but the frontline worker looking up, and us all working on this together. This project will allow the staff to feel empowered. It'll be their concepts, and we'll gain that knowledge and understanding, and possibly prevent more spread of the disease. There has been no COVID-19 at Villa Healthcare, and that's the way we want to keep it. And every day we're following CDC guidelines. We're transparent with all of the changes. Everything goes out to all staff at all times. And this concept of sanitizing your hands as you're going in, sanitizing your hands between each patient, between each gloves. And we did already do a building facility-wide audit. We put in place more hand sanitizers. We found our different dispensers all over the building in places that we were not using, and we put them 6 feet from each other down each hallway. And there are 3 floors. We maintained all the sinks, and we stocked all the sinks. Everybody wears a mask, and everybody sanitizes in and sanitizes out. That concept isn't new. Sanitize in, sanitize out. That's been happening at the hospitals for a long time, but now we've put it in place for the skilled nursing facility, and we're making this happen already. This was my project for this capstone, and I really feel it is very, very important, and it's already happening in the building. And I hope that in this project that I've done, that I've gained more understanding of pandemics around the world, and this one that we're in now, and how important hand hygiene is, and to all of our patients and to ourselves at home, in the workplace and at home and everywhere. Everybody is kind of getting on board again mentally, to continue to wash their hands and thinking about it more as a real thing instead of just something you have to do when you're giving care. Thank you.